think we might get going and we could admit people as they come through. So I'd like to welcome you to our fatigue management information session and begin by an acknowledgement of country. We acknowledge the traditional owners of the land on which we live and work and pay respects to elders past and present. I'm joining from the Ngamba country and I extend that respect to all First Nations people with us. So tonight we're going to cover the different topics are going to be types of fatigue, why positioning matters, strategies to support fatigue management, causes and contributing factors, and how physiotherapists and occupational therapists can help manage fatigue. So this is our team of presenters tonight. Some of them might be familiar to you, and they may actually be your therapists. So they all work at Muscular Dystrophy Queensland, and they're all part of our allied health team. So we've got Vicky, physiotherapist. We've got Christina, who's a senior OT, Zoe, a senior OT, and Stephanie or Steph, who's a senior OT also. So let's get started. So I'm going to hand over to Zoe, I think, and the team, and they're going to talk to us. And any questions, please pop them in the chat, or there'll be a question time at the end. Thanks.
Hi, everyone. Thank you for joining. So let's get started with just discussing a general definition of fatigue. So one is a reversible decrease or loss of abilities associated with a heightened sensation of physical or mental strain, even without conspicuous effort, due to an overwhelming feeling of exhaustion, which leads to an inability to sustain or difficulty in sustaining even routine activities. There's also physical and mental fatigue. So an example of physical fatigue is debilitating physical exhaustion or a distressing lack of energy not relieved by sleep or rest. And mental fatigue is mental exhaustion that appears especially during sensory stimulation or following mentally strenuous tasks. So these were definitions of fatigue that researchers found in interviewing people with chronic fatigue with different caused by different disabilities. It would be too long to mention other types of fatigue, but I'll give an honorable mention for emotional fatigue, cognitive, motivational, social, and psychological fatigue too. We can't talk about fatigue without considering the subjective experience of people with lived experience. So looking at this word cloud, we can see a number of different words that people have used to describe what fatigue is like for them. So I'll just give you a moment to have a look at that. Maybe some of these words resonate with you in your experience. Some of them are very obvious. So problem starting task, tiredness, lying down, a lack of energy, and then others might be more invisible. So things such as feeling overwhelmed, distressed, problems thinking clearly. So it's important that fatigue is seen in both a subjective view and an objective view as well. There's lots of theories on where fatigue originates. So we can categorize it as central fatigue or peripheral fatigue. So central fatigue is fatigue that comes from the brain, the spinal cord, caused by cortical atrophy or lesions, inflammation, and also mental health. So experiencing anxiety or depression, which can amplify the experience of fatigue for many. Some examples of different conditions that might have central deriving fatigue is myotonic dystrophy. So that's because of white matter lesions, daytime sleepiness, mood disorders. Different myopathies have impaired inflammation response and neurotransmitter synthesis. And spinal muscular atrophy, we see reduced alpha motor neurons and scoliosis, which is a deformity of the spine. And then peripheral fatigue, so that might be caused by reduced blood flow, poor muscle recovery, poor energy production, weakened force of muscle contraction, and neurotransmitter excitability. So we see, for example, in Duchenne muscular dystrophy and Becker muscular dystrophy that the NOS pathway has dysfunction in it. Limb-girdle muscular dystrophy, there's a lot of muscle fiber degeneration, FSHD, muscle cramping, and Charcot-Marie tooth disease, there's neuropathy. So with what I've just said, there's a lot of crossover. Of course, all these different conditions might have peripheral fatigue and central fatigue. It's just interesting to link the symptoms with where they derive from. There's lots of contributing factors for fatigue. So mental health, as we said before, poor nutrition or hydration, respiratory muscle weakness, medication side effects such as steroids, reduced cardiovascular function, too little or too much physical activity, poor sleep quality or sleep disorders, and musculoskeletal issues, including positioning, pain, and deformities. There's a big impact on the daily life for those who live with fatigue. It's important to note it's a multidimensional experience. It can cause frustration or low confidence, may feel unpredictable or hard to manage. It reduces social and community participation, and it may limit independence in personal care, work, and hobbies. Now let's discuss the role of physiotherapy in managing fatigue.
So the physiotherapy is involved in fatigue management in a few different ways. A physio can prescribe graded exercise programs tailored to the individual to maintain their strength, range of motion, and function based on your goals. We can also prescribe assistive technology where the physios look after the mobility devices such as walkers and wheelchairs. And energy conservation strategies that we'll talk about a bit more later on. We can also create stretching programs for contractures, which can be done passively with physios or carers, or active stretches as well to preserve your range of motion and reduce feelings of fatigue and stiffness. So with posture and positioning, physios also look at your posture and positioning and how this can affect your comfort and fatigue levels. Your muscles not only work hard during intentional actions, such as walking and moving certain objects around, they also need to work really hard to maintain your balance and posture, both in standing and sitting. So ideally, when sitting, whether it be in a school or office chair or in a wheelchair, we want to maintain close to 90 degrees at the hips, knees, and ankles, if your range of motion allows. And to keep our upper body fairly equal on the left and right side to minimize the risk of scoliosis or progression of other secondary complications. Some secondary complications also include skin integrity issues, and which can be caused by shear forces if you were to always be close to sliding out of the wheelchair, if you have a look at the picture on the bottom right there. And also to maintain the ideal neutral sitting posture can really work your postural muscles, especially when you need to be seated for long periods of the day, which is common for our full-time wheelchair users. This can cause a lot of fatigue just by sitting in the wheelchair. Using postural supports such as custom cushions, thigh guides, torso guides, and the like can really help take that work off of your postural muscles and still keep you in close to neutral spine position to minimize the risk of those secondary complications from developing. Yep. And looking at mobility aids can reduce energy used and in turn help manage fatigue. It can help you get from point A to point B, reducing the need to walk long distances. so you can reserve that energy to participate in activities that you enjoy. For example, using a scooter between your home and the shops or the park means that you can save that energy that you would have otherwise used, so you can use that energy at the stores or at the park, instead of getting tired by the time you get there because you've walked all this way. There are other benefits to using mobility aids, some of which directly relate to managing fatigue. By being able to save that energy mobilizing between point A and point B, it means that you'll have more energy and less likelihood of falls and injury as a result of being too tired, losing concentration and balance. It also means you have more energy to be engaged in school and other activities. You can also invest that energy into your hobbies, socializing, and developing other skills. And it can also decrease feelings of frustration as a result of fatigue. And maybe you'll think a walker still means that you need to walk, so these points don't apply as much to them. However, walkers can help someone walk more steadily and help with their balance, which reduces the need for your postural muscles to work as hard if you were to not use a walker. It also, more importantly, decreases your risk of falls as it helps you with your balance and decreases the risk of injuries as a result. Next, we're going to have a talk about seating tolerance. So sitting for long periods of time can actually be quite tiring, as I mentioned before, as you need to utilize your postural muscles to maintain that upright position. Postural supports can reduce fatigue in postural muscles and are customized to your needs. Taking a look at the diagram on the left, oh, sorry, it's on the right now. The person on the top has no postural supports and they're not in an optimal seating position. They have a slouched posture in the chair and their legs are poorly supported, making it very uncomfortable and tiring to sit in for extended periods. It can also result in an increased risk of sliding out of the seat, spinal complications, and skin integrity issues in the long term as well. Another example we have would be in the center and the bottom. That wheelchair you see there is an example of having some postural supports. There you can see a contoured cushion, armrests, backrests with some curve to fit the client's body, lateral torso guides to keep them center and upright in the wheelchair. And this is something that's customized to a client's presentation and needs. So the types of postural supports used and the specific setup will look different for each person. Next, we'll have a chat about exercise and activity. So, gentle exercise program is beneficial for maintaining strength and function and is individualized to your goals. What you need to do is track your energy levels after activities and exercise. Tracking your energy levels after exercise and also in the next day as well. If you find yourself to be too tired or have any concerns regarding this, you can discuss this with your physiotherapist and they can adjust your exercise routine as needed. And it is also a good idea to keep an activity diary and track what you do in a day. Tracking your fatigue levels each day and even at different times of the day to better track where your energy is going. And you can have a discussion with your physiotherapist or occupational therapist to make adjustments to your day, whether it be noticing that on certain days you make longer walks to the bus stop, whereas on other days you drive, and you feel very, very tired on a Wednesday, and it may be because of that, but it will be very hard to backtrack and remember what's happened through the week if you didn't have the diary. The goal is to reserve enough energy to do the non-negotiable routine activities that you need to get done in a day, such as your transfers and mobilizing, and still having energy to participate in your hobbies as well. And making sure to take breaks between activities and also during activities. Next, I'll pass this on to Steph.
Certainly.
The role of occupational therapy in fatigue management is similar to physio, but we do work together on this one. But basically, we look at the priorities of the individual person and set goals around the prioritization of activities that are important. So, for example, I've had like there's an example of a person wanting to cook for their children. You know, having the energy in order to do that at the end of the day. It could be looking at, you know, maybe a seat that they could sit on, or so that's just an example. There's many different ones. And then also recommending activity modifications to conserve energy. So that could be looking at the way the activity is done. For example, if there's, you know, cleaning a house, it's trying to break that activity into smaller chunks. So it might be focusing on a room instead of the whole house, or it could be looking at, you know, different days. You know, by the end of the week, you clean the whole house, but you've done it, you know, on a Monday, a Wednesday, and a Friday, and breaking it up, having rest days in between. And we also provide education on energy conservation strategies, and that could be through the use of assistive technology or ways of looking at what you do on a daily basis and breaking it down. We suggest and train in the use of assistive technology, such as mobile shower commodes, you know, electric beds, different types of assistive technology that can help with that energy conservation and comfort. And we offer support through individual or group programs to help with fatigue. We advise on environmental and home modifications, for example, stairs, you know, looking at, you know, a stair lift, or looking at, you know, grab rail, which can help. Sleep hygiene and optimal positioning in bed can also help, or in, you know, mobile shower commodes, or as Vicky touched on, in, you know, wheelchairs, but that's a physio role in our organisation. And these are just some practical strategies that might help you, but it's also important to note that not every strategy works for every single person. It's really, you know, an individualized approach, and sometimes it's really good to talk to your therapist about any of these strategies. There's no there's no cure for fatigue. We just know that there are ways of managing it and effectively. So some physical fatigue strategies are resting before reaching exhaustion or tiredness. It's also about alternating tasks of different intensities, so high, medium, or low. So, for example, if you've got hydrotherapy one day, it's looking at, well, what am I going to do the next day? It might be looking at low intensity activities the next day to rest and recover. Changing positioning. So sitting instead of standing, as I suggested before, can be a really great strategy so that you can complete a task. For example, sitting when dressing, sitting when cooking, or tilt and space seating, so you can alleviate that fatigue. Have a nap. Using assistive technology, mobility aids, and shower chair. Delegating tasks to others at home when possible. This is a really important strategy. So if you have people that you live with and they're non-essential tasks that could be done, could be, you know, the washing, or you know, hanging out the washing or something like that. So yeah, that's important, is prioritizing the tasks that you want to do versus what are the non-important tasks that you can ask for help with if you can. And adjusting the environment to improve function. So repositioning items and optimizing the layout. Can you be closer to the toilet, for example, or can you position your chair closer to your hoist? Cognitive fatigue strategies is a common one as well, which is looking at cognitive tasks, scheduling a time for really big cognitive tasks. So, for example, if you've got, you know, you know, you have to plan, for example, your week or schedule something. It could be putting a time, like a Sunday, you know, morning when you're feeling not so fatigued to do the really high complex tasks. Using planners, to-do lists, and reminders, timers. Breaking tasks into short, manageable tasks. Minimizing distractions when completing cognitive tasks. Resting your brain as well as your body, And using communication strategies also to express your fatigue levels to others so that they understand. And asking for help can be really a great strategy to help. And there are some other things that can also help reduce fatigue that we haven't covered, because it really is a multidisciplinary approach. So it's important to discuss medications and side effects as well with your GP if you're concerned. It's also about establishing a consistent bedtime routine and ensure adequate sleep and rest at night. Limiting caffeine and screen time before bed. It's called sleep hygiene. Allowing sunlight exposure during the day and daily gentle exercise. These all are proven to help with sleep quality. Maintaining a balanced diet and adequate nutrition, and seeking support for mental health if needed, a psychologist or counsellor. Now on to Christina to talk a little bit more about the 4 Ps.
Hi, everyone. I think this might be a little bit of a recap. So pace, plan, prioritise and position or problem solve. So pacing is breaking tasks into steps. So to complete over the day or even the week, I think it's been mentioned earlier, you might think about cleaning the house over the whole week and just doing 1 or 2 rooms a day. Resting early and often. It's much better to rest before you're severely fatigued to re-energise. Avoid overexertion and have rest days. So make sure there's a balance and energy for fun as well as jobs. Planning, so use routines and calendars. Try and match activities and rest with your most and your least energised times of the day, which can be different for everyone. Combine tasks when possible and schedule rest periods. Prioritise, so look at your day, look at your day-to-day activities and choose what matters most to you. And then, as has been said, if possible, ask someone else to do the tasks that are fatiguing and non-essential. Try to say no when you don't want to do something and it's not important to you, and prioritise rest and the things that are important in your day. And balance activities, so fun and rest and self-care. And then position or problem solve, so thinking of ways to make tasks more efficient. So be aware of your body position when completing tasks. So I think Vicky's mentioned this a little bit too. So think about whether you're sitting or standing and the option of using a perch stool when you're standing. Adjust your position to that 90-90-90 at your hips and your knees and your elbows as much as your range allows. And if you're using a power chair, thinking about using tilt in space and recline and all those other features. So we're very excited that we can offer the PACA Managing Fatigue program in the new year. So this is designed to help people who experience fatigue to take control of their condition through a variety of self-management strategies. So Steph, Zoe, I think Vicky also and I have done the training. So this program aims to reduce the impact that fatigue has on daily life. So I think, as Steph said, we can't change the symptom of fatigue, but we can change how we manage and deal with it. So this program involves teaching, reflection and homework elements. So we practice in the session different ways to save energy, how to rest strategically, and how to make active decisions that contribute to a balanced lifestyle. And then we go away each week and we try and do more practice at home. And then we come back and we share with each other how it went and we learn from one another's experience. So there'll be 6 sessions on various topics and the proposed dates will be released in the new year. So we'd love to have you join us again then. And if you're interested, then please send an email to info@mdqld.org.au or you're welcome just to speak to one of us directly as well, of course. And now I think I've got a time for questions. So if anyone has any questions, please feel welcome to type them in or to ask them directly.
We had some questions that came through the chat.
and just checking whether those questions have been answered adequately. Whether one of you could look at those questions and answer them. Christina, Steph, Zoe.
So Sarah Shaw, she asked, what is pelvic obliquity? Anyone want to take that one?
Vicky is probably the expert, but it really just
I
means
think
when your pelvis isn't straight. So if it's tilted one way, then often there's things you can do to assist with that. You know, you can put extra supports under the cushion on one side to create slightly more levelness. It's ideal if your hips, when you put your hands on your hips, if they're level. It's just like an efficiency thing with positioning.
And there was a question that followed, what is meant by sleep hygiene? I can see, Steph, you've answered that there. Do you mind just speaking to that, Steph, please?
Yeah, sure. Sleep hygiene is looking at, you know, the way that you sleep and thinking about good hygiene practices versus poor hygiene practices. For example, like a poor hygiene practice would be to not have a consistent routine and stay up all night and stay up late at night, or not getting enough sunlight during the day, or not exercising. So it's just something to kind of think about in terms of how it impacts fatigue levels, because there's a lot of evidence that suggests that looking at sleep hygiene, it can actually impact and help with fatigue and lessen it during the day. But there's a number of different strategies for that. But if you wanted to talk more about that, definitely reach out to your occupational therapist and physiotherapist.
Thank you. Now, please feel free, if you'd like to ask a question, you can either put it in chat, or I'm not able to see, because of the number of people that we have on, if you've got your hand raised, but please take yourself off chat and ask a question. If you want to do a general question, or if you wanted to ask about occupational therapist or a physio, please go ahead. Just give you a few more minutes if anyone has any questions or anything they wanted clarified. We've got a few that have come through. We've got a few that have come through now. Could someone please talk about why tilt and recline impact fatigue? I'm wondering, Vicky, whether that's a question for you.
Yeah, that would be. Yeah. Yeah, so with tilt and recline, it typically we're talking about doing that in a wheelchair. So that takes that pressure off of your legs and where you're and your bottom, and that allows those blood vessels to that allows you to rest some of those postural muscles that, even with all the postural supports, you still will have some postural muscles engaged. So it's resting those muscles that have been engaged for the past probably 10 hours and putting that pressure onto your back instead, in almost a kind of like lying back position. And it also has other benefits as well, such as promoting that blood flow, where you have that constant pressure if you're sitting in that same position. So promoting that blood flow back into in your legs, and that can promote healing and reduce the chance of pressure sores as well. So reducing some of those secondary complications. Yes.
Thank you. We've got another question here. Is difference between two levels best managed by stairs over short horizontal distance, or longer horizontal distance via ramp or slope?
I think that one might be me again.
Yes.
Yeah, I would say a longer distance with a ramp or slope, but that really depends on your setup and how and what your needs are. Ideally, ideally you would have something if that's quite a struggle for you, especially walking up slopes. There's a bit of a balance. So ideally, maybe you would have a wheelchair that can be pushed up that ramp or slope. But if we're talking about walking, if it stairs over a short horizontal distance, it depends on how steep the stairs are. That can be quite a difficult climb as well. But it also depends on your setup and if your balance can tolerate slopes and walking on like a slope or uneven surface as well. And having handrails makes a world of a difference for either of the two that you choose to have. Typically, the ramp or slope would be a better choice if we're thinking into the future, if we're looking at renovations and whatnot, just because that allows the use of anything on wheels, whether that be walkers, manual wheelchairs or powered wheelchairs as well. Yeah.
Thank you. Dane has said, and this can go to one of the OTs, I have trouble raising my arms up to put on a CPAP machine. Are there any apparatus that can assist with this task?
It is quite hard because CPAPs can be intricate to put on. I'm not aware of anything specific apart from there is the NEATY mobile arm support. I'm not sure if the other OTs have any other suggestions, but that would be something that I've seen on the market. I haven't tried it myself, but that helps extend the range of motion for your arm.
Dane, can you just clarify, are you talking about putting on the mask part of the machine?
Yeah, so it's trying to put the mask behind the head, the straps, and I can't physically hold my arms up above my head to put the straps on. So there's no issue with taking it off, it's physically getting it over the head so the clips can clip into the mask.
Yeah,
Can you just
that
repeat
sounds.
what that, or can you put in the chat or repeat what you said the assist was?
I'll type it in the chat for you.
Thank you.
Then yeah.
I can look into it. Yeah.
Yeah.
There's no other like actual other issues people had that you've used an assist for?
I think that's a great question. There might be some other people listening who have some good ideas.
Well, the OT hasn't had that before with anyone else at the moment.
I haven't had to problem solve that one, no. I think often people have a support worker available for things that are particularly tricky, but I think it's a really interesting one to think about problem solving yourself.
Thank you.
Erica put some good stuff down about sleep hygiene. Put simply, it's keeping your bedroom for sleep. Also, things like not using your phone close to bedtime, trying to keep a regular bedtime and routine, and also consistent wake-up times. Keep your room cool / warm, depending on your preference. So thank you, Erica, for that. Christine here has put vehicle seating passenger in front seat. How to increase lower lumbar support when in travels over an hour and a half. One of the OTs got any information that they can add around that? Thank you, Zoe.
So Is this for comfort? So increasing lower lumbar support. I know that iCare do really great portable wedge cushions for like lumbar rolls and things like that. I think that helps to create just a bit of support that natural curvature of the spine. I hope I'm interpreting your question correctly. That would be my best bet. You can also get really great mesh backrest that you actually put around the front seat. So that creates it for your whole back. So you get one that's just isolated just on your lower back, so like a round roll, or one that's more mesh contoured for your whole back. That would be my suggestion.
Thank you. Sarah Shaw has just popped in about the group Breathe with MD on Facebook, and that there's some good information there, and that's in the chat if people would like to take a look at that. And I think Christine has asked just what is the name, what is the company's name? Do we know, Zoe, or is that something we would need to send out to Christine?
I can send that to you, Christine, but I like the iCare brand. They do really great foam, like dense foam. There's a few other brands as well that do mesh products as well. Thank you, Sarah. There's a few other ones that I can send as well that I quite like.
Thank you. Well, we have a couple more minutes if there is anything else that anyone would like to ask.
And if you are trying to ask anything and we're not responding, it's probably because you are muted. So if you could unmute yourselves and
good question.
ask. Otherwise, yep.
So there's a few different things that Zoe's putting in now into the chat, which will be available afterwards. Ross has just come through. I have issues getting into bed. I usually drop backwards into bed and then try and throw my legs up into the bed. My muscle weakness at the end of the day can leave. Sorry, just got a message come through. My muscle weakness at the end of the day can leave my legs very weak. Any suggestion, please?
I think that's quite a big question, Ross. I think that it would be really good to talk to your physio about your concerns if you have one. Did you have a treating physio that you're seeing?
We have Vicky here as well, who might be able to help.
Yeah, definitely. If you
Sorry, I thought that may have been an OT question. So with this, part of it is all of that managing fatigue and making sure you have enough energy to manage your nighttime routine. So those are your non-negotiables. No matter what, you still need to make it to bed and be able to get yourself into bed safely. And another thing would be more on the OT side of things, looking into a bed that lifts up, which would make it easier for you to sit on it and get into bed. But with swinging the legs across, that at least to my knowledge, I think it would be more so not an equipment thing, but rather managing that fatigue so you have sufficient energy to do that. And making that a priority. Maybe have to look into like your specific situation and seeing if there's anything we could do on those really bad days where you've accidentally overexerted, and seeing if we can find a solution for that. But that'll probably be more of a us assessing your environment and what movement looks like for you in those situations.
And Ross, if you're able to transfer without any mobility device, just with a side transfer, you could always on your wheelchair have a support surface in front, have your legs lifted up and then shuffle across. So your legs have to move less against gravity, if that makes sense. So you're sitting in your wheelchair, you have your legs resting on another support surface and you're moving across, and then move your legs across. So you're not having to move your whole legs from the ground up. That makes sense.
Thank you. As Steph said, that it is a big question, and I guess it's individual, depending on the needs of the person, and that's something that that a physio or OT could assist with. Nina, thank you, Nina, has just popped in here a leg lifter, which she has found has been helpful to her. Zoe's just popped in as well, some more information about the vehicle seating. So I think we will draw the questions to a close now, so we're not holding you up all evening. The slide has come up with the email address, info@ndqld.org.au. If you have questions, please pop them in there, email us, and we will get back to you. This will be available to watch shortly, so you'll be able to go through and have a look at it again, and take down some notes, re-listen to it. You can follow our Facebook and our Instagram for more information sessions, announcements and updates. And as Christina said, there will be a 6-week program, which will be several hours, sort of a session for one day for 6 weeks. So we'll send information out about that. Coming very shortly is our community event calendar for 2026. So that's coming out in the next week, which has all the different information sessions, all the different events that we have. So thank you for joining us. We hope that you have found it helpful and informative, and have a nice rest of your evening. We do have, for those who like to dig deeper, at the end of this presentation, we have a list of all the references that have been used to come up with the content for tonight's presentation. So you're welcome to have a look at those, put them into the search engine, and read those. So thank you everybody, and have a nice rest of your evening. Just for those who haven't left yet, Sarah Shaw, who runs our community liaison group, has just popped in that next Wednesday we have our virtual coffee and chat. So that's a great time. It's informal. A group of people get on who have a neuromuscular condition, and there's some general chit chat, social time, and then people also raise questions and share information, which is really helpful. Sarah, I don't know, Sarah Shaw, if you're available to say just a few words now, or you might not be able to at the moment, but if you are, just pop on or send me a message.
Yeah, I just wanted to mention that it is next Wednesday, and if people do want to come along, it's the place where those sorts of questions around how do I put my mask on, etc. Has anyone got any issue, ideas about how to get into bed? That's the sort of stuff we discuss nearly every month. Get ideas from people living with the same sorts of issues that you've got, and you don't know what you don't know. No questions are too weird or wonderful. And if you want to come along, it's you can either join the MDQP support group on Facebook and get the event link from there, or send the CLG chair at mdq.org.au. Am I saying that right, Penny?
Sounds good to me.
Email a message and I'll pop you in the invite. I hope to see as many people as possible.
Thanks. Thank you, Sarah. And the other Sarah has put your email address into the chat so that people have got access to that. Yeah. Thanks.
Great.
Thank you, Sarah. And thank you, everybody. Have a good night.
Thanks, everyone.
Thank you so
Bye-bye.
much. Bye.
Bye.